You're listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. Today I'd like to talk to you about the use of braces for knee pain and knee arthritis. Now, we do have braces for two very specific indications in orthopedics. So something such as a fracture or a ligament rupture. You most commonly see a lot of professional football players, if they've torn a ligament, have a big carbon fiber brace. So we have very specific braces. But what I'd like to talk to you about today is the more common patient that I see, someone that comes in with knee pain from arthritis, and they're wondering whether or not a brace can help them. Now, typically, I'll see someone that walks in with a shopping bag, and as they start asking this question, they pull out a brace that's just a neoprene knee sleeve, and then one that has a hole over the kneecap, and one that doesn't, one that has some Velcro straps, one that doesn't, one that has hinges, one that doesn't, some with copper, some with magnets. And, a lot of times those patients have really done their due diligence. They've basically tried every brace that they can get their hands on, and they say that none of those braces made any difference in their symptoms. And their fear is that they're worried that by not wearing a brace, that their knee is going to get worse. So I let that person know that it's okay that they're not wearing a brace, that the arthritis is going to get worse no matter what, and not wearing a brace is not going to make it accelerate or get worse quicker or make you have more pain. Now, the flip side of that is there are some people that will see a lot of benefit from braces. Now, who are those people? Well, I have patients that deal with a lot of swelling. So what they do is they find that by using a neoprene knee sleeve, and they use this when they do their activities, which commonly cause their knee to swell, that pressure prevents their knee from swelling. I also find some people that like to do activities early in the morning or when it's cold outside, and that they notice that when their knee's warmer or warmed up, that it feels better, it's looser. So they find that by wearing some type of brace, it keeps the actual area around their knee joint warmer, and that lessens their pain and makes their knee feel more fluid to them. Now, what about the person that says, yeah, but my brace stabilizes my knee? Well, again, there are braces very specific for stabilizing a knee that is unstable because of a ligament tear. But what we're talking about usually is that sense of instability, that the knee wants to buckle or give way. And what a brace will do to those people is it puts pressure on the skin, and it gives you what's called proprioception. So what that is you have very different senses and feelings inside our body than what we do on our skin. And you have a lot denser nerve endings in your fingers and toes than you do elsewhere. So if you've ever put your hand on your knee as you've stood up from a chair, you're not really stabilizing your knee per se with your hands, but you're putting pressure on the knee, and it helps you and your brain know where your knee is in space and what you're going to do to stabilize it. So when you put this brace on your skin, the pressure from the brace adds to that feeling, or what we call proprioception, so you're more likely to be aware of where your knee is in space. And this has a tendency to prevent people from getting up too quick or turning, pivoting, twisting, squatting down deeply. And those are the things that typically will cause that sense of pain or instability. Now, when it comes to these specialized, more custom style braces, these are doctor-prescribed braces, and the most common kind that you'll see is what's called an offloader brace. So what is an offloader brace? Well, an offloader brace does just as it sounds. It offloads a part of your knee. So let's say that you have bow-legged arthritis, what we call varus, where your knee kicks out to the side because you've lost more cartilage on the inside of your knee, and that's where you're more bone on bone. So that's where you have more pain. So the idea of an offloader brace for that person is it pushes the knee from the outside to the inside, and it tries to gap open that space where you're more bone on bone. And if that's the part of your knee that's causing more pain and you take some of that pressure off, you've lessened that person's pain, you've straightened out the knee a little bit. And there's the opposite style of brace for someone that's more knock-kneed, where they've lost the cartilage space on the outside. So a lot of companies now make these off the shelf, or you can get a custom brace depending on the size of your leg if the regular braces don't fit well. Now, the problem that I see with these braces is that you have to wear them all the time. It's not a brace that you would wear for a fracture, and then the fracture's healed and then you stop wearing the brace. You have a long-term degenerative problem. So this is a brace that you will have to use essentially until you had your knee fixed with a knee replacement. Now, who do I see that benefits the best from these braces? Usually younger individuals that are more muscular. Why? If you're older and you don't have good muscle tone, a lot of times these braces do put a lot of pressure on the skin and on the body, and they can be uncomfortable. But typically I'll see a guy that plays tennis or golf, and they will use this brace when they're doing that activity. Or if I have a woman that enjoys hiking a lot, and when she goes on longer hikes, she has more pain, she may put this type of brace on for that hike or for that event, and then she will take it off for other activities. So those are very specific braces called offload braces, which are typically prescribed by a doctor. Now, when it comes to all of the over-the-counter braces, I always tell my patients that start with the smallest, cheapest, most inexpensive braces. Slip-on knee sleeve is nice. The ones that have the Velcro straps are okay because it allows you to adjust. There is a tendency, though, for people to make them too tight, and this can lead to swelling, especially below the brace. You want to make sure that the brace is fitted appropriately. And if you get one without a hole, you can always take a pair of scissors and cut a hole into it later. I'm not a huge fan of the over-the-counter braces that you can buy with hinges, especially if these are small, flimsy metal hinges that are inside that neoprene tissue. And the reason is that if you actually pick them up and bend them, you can bend them with your fingers. So there's no way that that's going to support the stability of your knee from your body weight. But what's worse is a lot of times as those braces wear down, I will actually see them cut through the neoprene and they've actually cut into the skin. So you have to be really cautious if you have braces like that. And because you're wearing a brace on your knee, especially if you're using it during activities where you get hot and sweaty, these can get dirty. So you want to make sure that you take these off, you wash them, you dry them appropriately, and occasionally you may need to throw that brace out and get a new one. And if you're having surgery and you've been accustomed to wearing a brace, I always have my patients stop wearing that brace for a week or two before surgery because you don't want to have that brace on and then develop some sort of rash or irritation to the skin just prior to surgery. So there you have it, a little bit of information about braces, things that you can use over the counter, as well as some basic information on some prescription braces that you could talk to your doctor about to determine whether or not you're a candidate for those specific type of braces. But again, if you do not wear a brace for general run-of-the-mill arthritis, not wearing a brace is not going to make your knee arthritis get significantly worse. And if you've tried a whole bunch of braces and none of them help you, that is okay to just go on with life as is with the medications and exercises that will help your knee and your health. But if you haven't tried a brace and you're having pain and you've done exercises and weight loss and used pills, it's a reasonable thing to try an over-the-counter brace to see if it helps with your pain or your symptoms or your swelling, or just makes the knee feel generally warmer or less stable when you do your daily activities. So until next time, thanks for listening. Please subscribe so you'll be updated when future episodes come out. And if you believe that you have one friend or family member that could benefit from this information, please share this information about the podcast with them. This is Adam Rosen, and you've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.